Whether you're looking for a Chevy car, truck, or SUV, go see my friends at Apple Chevy in Tinley Park. With over 500 new and used vehicles in stock, they have what you're looking for, and at the lowest price possible. Go to applechevy.com. We're talking to Dr. Nidal Abaridi. He is a Chicago physician who was actually on duty at Mercy Hospital the day of the shooting almost 2 years ago. And you're part of a group of people who are trying to make sure that first responders are able to get tested and PPE equipment as soon as possible. Tell me a little bit about what it is that you're doing.
We are actively trying to bring awareness to the shortage of not only protective personal equipment, but also staff availability to test first responders and people who are in our beginning trenches of this horrible situation. The drive that has been put forth by Dan Herbert, by Big Mart Marketing, and Kavanaugh, and by the Blue Line Security has been to not only accept donations for personal protective equipment, which includes, obviously, masks, gowns, gloves, but also to create some homemade hand sanitizers based on the currently released FDA guidelines, which have kind of depicted a rather complicated process of how to perform at the kitchen table. Myself as a physician, because of the ties that I have to the Chicago police community, I felt as my clinic, which is strategically located in the Chicago South Side at 1921 South Michigan Avenue, is possible staging ground where police officers and others members of the Chicago Police Department can find answers to whether they need to be tested and how to properly be triaged so that in case they do need indeed testing, that we can bypass the long waiting lines in other locations and appropriate them accordingly.
And they can come directly to your office? Do they have to call in advance?
Yes, there is only so many appointments that can be made in a certain day. The best option is to actually make a phone call and reserve a spot. Not everybody is a candidate for testing. The very first aspect of this is to essentially triage a patient, in this case a Chicago police officer, appropriately. There are certain guidelines that we all have to follow. So rather than just checking upon in the same way like most people have been used to going to a physician's office for a particular ailment, we want to be able to, number one, reassure the person who's on the phone based on the symptoms they have, what is the next best course of action. In order to do this and to be able to reach a greater audience, the best way to reach towards us is call our office or email and request an appointment where I will personally discuss with each police officer the next steps that need to be done. And if based on my interview with them, a physical examination needs to follow through, or if they have to be tested, then I would invite them to the office and then...
So you're starting with telemedicine and then working your way toward an office visit if it is absolutely necessary. And this is only for Chicago police officers?
Well, we do this regularly with all of our patients, and I have offered this as a free health screening for all of the Chicago police officers, but anybody really can call and want to pay in a line. But I personally actually have a passion for all first responders, and as you very well know, Chicago police officers are one of the team members. EMS is the next line, then Chicago Fire, and then, of course, long but very often forgotten CTA bus drivers and employees. So I'm more than happy to offer, obviously, screening for any member of our community, but preferentially we're giving this specifically to Chicago police officers. And
how do they contact you?
Very good question. So they can find us. The name of our clinic is Loop Medical Center, Loop, L-O-O-P, and we're located at 1921 South Michigan Avenue. And our phone number is 312-414-1088, 312-414-1088, or our email, which is very simple. It's schedule@loopmedicalcenter.com. So it's schedule@loopmedicalcenter.com.
Okay, and again, this number that you've given out, only police should be calling this at this moment, active duty Chicago police officers.
No, actually, we have multiple members of our staff answering the phone line that can accommodate all of the members of the public. So we just have a specific set of requirements that we're giving towards Chicago police officers. But that is the same number that every single member of our community can call.
And is this screening then going to be free for the police officers, or at least covered 100% by their insurance?
Yes, 100%.
Okay. All right. Very good. And how many have you done so far?
This is the first day, so we have just launched this 10 o'clock in the morning. We have done 3 so far, and we have 10 more patients scheduled for between 5 and 7 p.m. tonight.
And again, you have to be symptomatic to get the office visit, right?
Correct. And this is really the right thing to do, because we are trying to do social distancing. We're trying to do all those measures that are conservative. So, being able to speak to somebody and ask them a poignant question, which is, do I need to be seen by a physician in person, or do I need to get tested? It really allows us to be in compliance with all the guidelines which were set by not only CDC, but also by Illinois Department of Health and Professional Regulations, which is to properly screen, properly triage. And as you very well know, in today's day and age, we have limited testing ability, and until more rapid tests, which are apparently up on the horizon, Abbott, if you know, has just released a possibility that we'll have probably 50,000 new tests being available each day beginning next week. Then obviously the policies and guidelines will change. But now in a concept of a triage, much like a good police officer, a good nurse, or a good EMS provider will tend to the ones who need it the most. And then based on the symptomatology and based on the exposure of active police duty officers to people who are actually infected, we need to give them the correct guidelines that are, to us, fed by CDC and IDPH.
So if you're a first responder or CTA employee, you're symptomatic and you want to get tested, the number, once again, 312-414-1088, 312-414-1088, or by email, schedule@loopmedicalcenter.com.